Hello and welcome. My name is Gary Swan, and I'm here with Risa Stephenson, and we're here to talk about telehealth. During this presentation, we're going to talk about what is telehealth, a little bit of history on telehealth, look at mental health, home health, and then look at some of the implications moving forward.
So, what is telehealth? The World Health Organization defines telehealth as the delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment, and prevention of disease and injuries, research and evaluation, and for the continuing education of healthcare providers, all in the interest of advancing the health of individuals and their communities. The intent of telehealth is to provide clinical care at the same level of quality as in person, but remotely. Roughly speaking, providers can virtually beam into the home while at the same time read the patient's electronic medical record, see active ECG readouts, blood glucose, various scans, and really use any tool that could be operated remotely. While telehealth clearly isn't for everyone, it allows providers freedom and gives them flexibility when seeing patients. With this tools, providers can give care directly or act as consultants to primary facilities. The hope is to enhance the capacity to provide services at the primary point of contact, reduce barriers, and increase access. Moving forward, telehealth will allow increased capacity and reduce costs. In practice, the patient interaction through telehealth becomes natural that the engagement between the patient and provider is the focus. The technology melts away and we are left with meaningful interaction. As though the provider is still in the room, those emotional ties that link us with our patients is still present.
With a short history, telehealth has existed since the mid-19th century. During the mid-20th century, the first ECG was beamed across telephone lines for remote consult. Over the years, televisions and cameras were introduced to telehealth. The first in mental health, and then connecting facilities or linking with patients in their home. In an interview with Providence Telehealth Director Denny Lorden, the notion of curbside calling is not uncommon. This is where the primary provider calls another physician to ask for advice on a patient. This process is so common in some areas that facilities have developed protocols around such engagements. The ultimate next steps are obvious with the enhancements in technology. The use of the internet, email, portable devices with cameras and peripherals that allow us to track patients in real time is going to become more and more commonplace. Looking forward, a couple of areas show incredible promise and are already being developed. The first and most obvious use of telehealth is in the area of mental health.
So, the number of Americans affected by mental illness, according to the National Alliance on Mental Illness 2013, 1 in 4 adults, that is approximately 61.5 million Americans, experiences mental health illness in a given year. 1 in 17, about 13.6 million, live with a serious mental illness such as schizophrenia, major depression, or bipolar disorder, and approximately 20% of youth ages 13 to 18 experience severe mental disorders in a given year. Approximately 60% of adults and almost one half of youth ages 8 to 15 with a mental illness received no mental health services in the previous year. African American and Hispanic Americans use mental health services at about one half the rate of Caucasians in the past year, and Asian Americans about 1/3 the rate. In the U.S., serious mental health illnesses cost $193.2 billion in lost earnings per year. Mood disorders such as depression are the third most common use of hospitalization for both youth and adults ages 18 to 44. Individuals living with serious mental illness face an increased risk of having chronic medical conditions, and adults that live with serious mental illnesses die on average 25 years earlier than other Americans, largely due to treatable medical conditions. Suicide is the third leading cause of death and is the third leading cause of death for ages 15 to 24 years. More than 90 of those who die by suicide have about one or more mental disorder. So, what are the current challenges? According to Clark and Yarborough 2013, the U.S. has limited reach of mental health services, and solving this problem will require innovations that enable us to extend our clinical reach into underserved populations without significantly expanding our workforce. Access to quality mental health care is limited for nearly all populations, especially for vulnerable populations that includes racial, ethnic minorities, the socioeconomically disadvantaged, and rural populations. The limits on the reach of mental health care can occur at a variety of levels located within organizations, providers, and patients. At the organizational level, there is a shortage of mental health providers that can limit reach in rural and low-income counties. The provider level barrier can include discomfort with assessing and treating mental health conditions, beliefs about treatment ineffectiveness, resource and time constraints, and burnout. The patient level barriers include cost, health insurance coverage, distance to mental health providers, and a lack of English proficiency, stigma, and consumer discomfort with disclosure. So, how can health information technology improve the reach of mental health care? Health information technology includes smartphones, apps, or desktop software, and internet holds a huge promise for significantly expanding the reach of quality mental health care. Health information technology and interventions has the potential to reach wide geographic area via remote delivery of care and decrease the cost in delivering self-help and social networking interventions. By developing and disseminating health information technology, mental health interventions, there is a potential to enhance reach by reducing multiple barriers to care. This can be an area where mental health specialists may be limited or unavailable, such as rural communities, low socioeconomic status areas, or primary care clinics. It can also be in situations where demand for mental health care may suddenly increase and outstrip existing capacity in the case of a natural disaster. Another area where health information technology can have a meaningful impact is in the area of home health.
Home health remote monitoring technologies can be used to keep patients in their home and out of hospitals. Traditionally, families and providers have to visit the home to deliver care, follow up with medication, conduct therapies, and offer other services. Study reveals remote patient monitoring and remote communications are capable of delivering the same level of care as traditional home health services. According to a Kaiser study, outcomes were comparable to visiting in-home services, and according to a study by Jones et al., at times services and outcomes exceeded expectations in comparison with in-home services. Telehealth saves travel time for patients, specialists, and reduces out-of-pocket expenses. This, coupled with increased capacity to serve patients. Providers can see more patients and still have excess time in their schedule to follow up. Patients tend to be just as satisfied with service levels, and health quality outcomes are on par with established systems. Even early in the era of telehealth, with televisions and large camera setups, outcomes were positive. In the study by Dimmick et al., patients felt more secure, liked the ease and flexibility of services, and felt they were getting quality service. Patients felt a sense of increased security, control, and personal care. They recognized the cost savings, and generally found the technology easy to use. Providers recognized remote visits resulted in greater focus among patients, increased productivity, and a stronger ability to manage healthcare. As we move forward in the era of telehealth, home health services are going to be the norm. Providers will have real-time data linked with EMRs, be able to set thresholds based on real metrics, be able to beam into the home with ease, provide therapies, conduct medication reconciliation, and much, much more. These solutions will also help identify care across care transitions. Underlying home health services is the need to measure health outcomes and determine points of intervention and ultimately find those places where care must be changed. Telehealth uniquely links providers in the care loop and helps families find and determine when long-term services are needed. In the context of families, culture, and population health, telehealth is going to have to be leveraged in order to meet demand, and we will need to be integrated into our offerings. The pervasiveness of these tools is only going to grow. As we have learned, one must not lose sight of how families interface with their healthcare and how we try to view care empathetically from our patient's perspective. Though these elements provide an added layer of complexity, they will give much added value and insight into health and well-being of those under our care. As potential administrators, in order to meet increasing challenges and maintain sustainability, we see the use of these technologies vital. Used as appropriate, these services can help to move our organizations forward into the 21st century. We look forward to seeing your views on this topic. Telehealth impacts us all, and as nurses on the front lines, your profession is likely to see the brunt of implementation. How do you feel about telehealth in the home, in the use of mental health, in the ER or your department? Do you see these technologies as a boon to your capacity to serve patients, or simply as another thing you'll have to keep up with and do? We thank you for your time in watching our presentation, and here are our references. Thank you, and goodbye.